my good side, Jim. So, thanks everybody for coming. And Jim, I want to say a personal thanks to you for hosting these fora and for fostering this air of communication. Only just last night at the hospital, I was told that the rumor mill had it that I was feeding info to the enemy. And so this morning I had to go and talk to someone and say, I understand you have issues with me, and what are those issues, so that we could discuss them. And there was this whole, no, I heard that so-and-so said, and then we thought maybe you were on that side, and maybe you were on this side, and we, so these four are very important for that, because we've had a whole lot of divide and conquer happening here. And the more we talk, the more we know what's true. We don't have to agree about everything. We can agree to disagree. I think it's just important that we talk and know where everyone is coming from, so that everyone is comfortable at the end of the day with whatever decision is made for healthcare here in this community. And while I may not be of this community, I have been here for 14 years, and I do consider this my home, and I have considered this my home since I first came here. There are a lot of places I've been to that I was like, not going back there, I want to go back to the falls. And this is a choice that I've made regardless of whether I'm physically a part of this community or not. So that was the first thing I wanted to say. Second thing is, let it be known that I am not an employee of RLMC or Essentia in any way, shape, or form, and I do not speak for RLMC management or on their behalf. The info that I will present is public info, and anything that I say otherwise is my own conjecture or my own point of view. Thirdly, my goal here is to provide some definitions about what is available at RLMC right now and what the hospital basically is considered right now. RLMC is a 25-bed critical access hospital that has level 4 trauma center designation. Being a critical access hospital is a federal definition. You have to have a certain number of beds. You have to be at least 35 miles from the next critical access or reasonable hospital. I think we're like 90 miles from Virginia, or 15 miles in rugged terrain from the next nearest hospital. So either way, we fit either criterion for that. Being a level 4 trauma center means that we have 24-hour emergency services available, that we can initially stabilize and do some diagnostic tests on trauma patients, and that we have a relationship with other facilities to whom we can transfer patients should they be sick or ill. Okay, so now I gotta go through my list, because then I have a whole bunch of things. The services currently available at RLMC include 24 hours a day, 7 days a week, emergency care with nursing staff and physicians always on site for the emergency department. For critical access hospitals, it is not essential, is my understanding, that you have a physician immediately available, but that one is pretty close to immediately available. At RLMC right now, we have physical therapy, and our physical therapy department at the hospital is phenomenal. They offer a number of services. They have a wound care clinic. They have a women's health service clinic. They're doing a new concussion outreach to the community. They have a neuropathy clinic, all kinds of things. We have occupational therapy. They also go to the schools. We have speech therapy, and the speech therapist also does swallow evaluations and swallow studies and swallow training. The speech therapist here has been here now, I think, 2 years, relatively speaking. We have OB-GYN, and I'll go into that a little bit more in a little bit. We have orthopedics. We have some limited urology. We have general surgery. Our radiology services are also phenomenal. We have nuclear medicine studies done, like HIDA scans for gallbladder surgery. We're doing cardiac studies, medication-related stress tests. They do interventional radiologic procedures, biopsies. I have an ultrasound-guided biopsy at our hospital here. They do joint injections. They do CT myelograms. We have MRIs, CAT scans. We really have a full-service radiology department here. We have cardiac rehab with 2 full-time nurses who recently went to St. Mary's for additional training. They are overseen by a physician, but right now they basically do their own thing and do it phenomenally, and they have for probably about 10 years now. Stress testing is available at the hospital. We have chemo and infusion therapy. We do outpatient blood. We do medications for people who have rheumatoid arthritis and all kinds of other medical issues. We have dietary and nutritional services. There's an audiologist who comes to the hospital. Our lab services are really widespread and pretty phenomenal too. We have colonoscopy, and we have a swing bed service. Now, critical access hospitals also have this definition of swing bed that goes with them, but basically in rural areas where you don't have a whole lot of rehab facilities for people who are sick enough to be to the hospital but are not quite well enough to go home, they can go to a rehab facility in most parts of the country, but when you're in rural areas like this, there aren't a whole lot of rehab facilities. So there's this special sort of hospital bed called a swing bed. You're not good enough to go home. You need a little additional care, skilled nursing, maybe a couple more lab tests, maybe a couple of services that they can't do in the nursing home, like IV medications or Foley catheter. So you're allowed to be in a swing bed for up to 30 days, I believe, and there's some designation that the hospital has to have average occupancy of less than 3 days. Okay. Let's see. No longer at the hospital do we have an intensive care unit, and I think it's been about 5 years that we stopped having an ICU. We no longer have ophthalmology at the hospital. We have limited inpatient pediatric capability, and that's partly due to how we're staffed right now at the hospital, and I'll get into that in a second. And we've never had respiratory therapy, which I have wished we had forever and a day. As far as providers that we have at the hospital right now, we have our local and our casual nursing staff, and most of those are of this community. There are a couple of people who truck it in from Canada. One of them's here right now. She shall not be named. There are a couple of people who come from 45 minutes away and things like that. But most of them are local. Our anesthesia care is through Sheffield Anesthesia LLC, which is basically a locums type anesthesia service, but one person mainly does our anesthesia. When he's on vacation or off ill, one of our local nurses' husband is an anesthesia nurse also with that group, and then he covers the hospital. So for the most part, we have one anesthesia CRNA who's with us about 95% of the time, and he's just fantabulous. The ER, urgent care, and hospital physicians, nurse practitioners, and PAs work through a PD, which is a locum tenens company. Locum tenens means basically traveling medical people. And that group took over about 5 years ago. Before that, it was Sterling. Sterling did a hospital takeover of Silver's group that was covering the ER before that. About 15 years ago, the family med physicians actually were on call for the emergency department and would come over to take care of patients during the day, and then they would stay overnight to take care of emergency care patients. OB-GYN service is through both the local family physicians and through some privately contracted OB-GYN physicians, so that there's fuller coverage and non-stop coverage basically. Surgery is through a physician who's contracted through RLMC, Dr. Avestia. Other providers that we have, I can't speak well enough of our paramedics. We now have 6 full-time paramedics, and we're working to build a closer relationship with them and have them do more, have protocols for them at the hospital for when we need those extra hands. For instance, in January when we had a big trauma, they came in and stayed with us, and it was just phenomenal. It provided great extra care. The other thing I was just going to mention was some of the numbers as far as admissions in the emergency department, the hospital, and some of the ambulance information. This is the wonkiest mic, you know?
A switch?
Yeah, you want to try this one?
Yep.
Maybe this one will come up. Okay, so for 2010, the ER had 5,898 visits. But urgent care had 2,641 for a total of 8,539. That basically means that everyone in town came through the ER 1.3 times, basically, because we have a population of about 6,000. 2011, 2012, the numbers went down a little bit, 8,445 for 2011, and 8,124 for 2012. ER visits and urgent care visits in the summer tend to spike because we get a lot of tourists. We have all the people who go to Canada get shoveled down to us. We have, when the mill shuts down, all the incoming workers come in through the ER and urgent care. Some do go to clinic, and I'm always excited when they do that because it decreases the influx of the ER and urgent care. The hospital visits for 2010 our admissions were 687. Those also went down in 2011 and 2012, 669 and 475. We had 40 swing beds in 2010, 36 and 50 in 11 and 12. And our newborns were 77 in 2010, 88 in 2011, and I know that was a really big year. And throughout the county, there was a decreased number of deliveries in 2012. Our hospital was 57, and I know from what I've been told that countywide there was a lower number of babies born in the whole Coochin County, and it was felt that these lower numbers did not represent that little schism we had with regard to whether or not we were going to have OB coverage. We have had 89 ALS transfers in the first 3 months of this year, 123 advanced life support runs by our paramedics just this year, and that's quite a bit. There are, of course, times when there are more and times when there are less, but they are providing a great service to this community. Unfortunately, they're not formally affiliated with either the hospital or the clinic, but they are working very hard with us, and I hope they continue to do so. I think Kim's probably going to speak next, and then we can probably do some general questions afterwards if needed. Thank you.
Thank you very much, Ricky. That's much more information than I was able to present. I would love to have someone give a similar picture for the clinic, and I think we will be able to have that in the near future whenever we're able to arrange them to come up and speak. I wish I spoke less fluently.